Welcome to another episode of Decluttering 55 Plus with Michelle Passoff. It's here that we speak with experts, authorities, geeks, authors, and everyday people about the many ways we might have never imagined that you can invigorate your life as you age. And at the end of the day, create a legacy, not a mess. We talk about health, fitness, and eating. We chat about writing our life stories, about improving relationships and strengthening connectedness, deciding where to live and what to do in retirement, even financial and legal matters, and pre planning final arrangements. We open up all the possibilities in our lives on the road ahead by learning and exploring new and unimagined possibilities in our lives. When we speak about staying healthy year after year, the first thing that comes to mind may be keeping your heart pumping, your mind sharp, and your muscles strong. Certainly, those things are important, but what about your teeth? That's right. Are you paying enough attention to your pearly whites? What are you doing to take care of your teeth? What should you be doing to take care of them, and what are the consequences if you don't? Our guest today is going to bring to the forefront of our mind the importance of care to our overall health, especially as we age. Dr. Sonya Dunbar is a registered dental hygienist and a nationally recognized authority on geriatric oral health. She has earned the affectionate title of the Geriatric Tooth Fairy. She is the author of The Tooth and Nothing But the Truth, a geriatric dental hygienist and geriatric dentist's guide to oral care for the aging population, and Forgotten Mouths, the complete guide to geriatric oral health in long-term care facilities, nursing homes, assisted living, mobile and portable dentistry. Among many other things that she does, she is also the co-founder of Mobile Dental Express, a thriving mobile dental company operating in 3 states. Welcome, Dr. Dunbar, to Decluttering 55 Plus with Michelle Passoff, and thank you for being here. Well, tell me, what should we know about oral? Why is oral health for you as you age different than it's ever been? And tell me how and if.
Well, oral health is more important as we age, especially when you have other comorbidities. If you have diabetes, high blood pressure, anxiety, any of those things, gout, any of those things, if your oral health is not healthy, it makes your whole body unbalanced and unhealthy. So as we age, it's so important. Even chewing our food is so important so we don't get constipated and block bowels and everything. So the mouth and our teeth are so important as we age.
What if you've never really taken care of your teeth before? Is it ever too late to start taking care of your teeth? And what's the best way to get started, get on track to better dental health care?
It's never too late. Um, it's never too late to start taking care of your teeth. But if certain things, like if you get gum disease and you lose all your bone, then you may have to get dentures. That's still taking care of your mouth. The best way to get started, the first thing I would tell anyone to do is to go visit the dentist. Even if you have dentures, go visit the dentist. That's the one person you need to see at least once or twice a year, because if your mouth isn't healthy, your whole body isn't healthy. A lot of stuff comes in our mouth, bacteria, food, and everything. And that's how we eat. That's how we live. We even breathe. So if your mouth isn't healthy, your whole body isn't healthy.
Well, so you start by going to the dentist. Um, how do you choose a dentist? What's the best way to choose what dentist to go to?
I think that you should get a dentist, especially if you're a more seasoned adult. Most of the time, you have a dentist that you've taken your kids to, or people in your family, or people at your community centers, or wherever you go. The best way is word of mouth. Or if not, if you're in a new community, you're not connected. The first place I would reach out to is what my insurance will cover, because dental care can be expensive. That's why I tell people,
Yes.
as you begin to age, I tell people, really, before you retire, if your dentist has been telling you that you need to get a bridge, a root canal, a tooth fix, get it done. Because once that insurance changes, you don't get a lot of things covered. And then when you're on a certain type of income, that makes a difference. So I tell people, listen, if you haven't taken care of your teeth in your 30s and 40s, when you get around them 50s, you need to start smoothing on into that. especially the closer you get to retire, get the retirement, get those major things done. Because when it comes to picking dental insurance, when you're dealing with Medicare, it's a different animal than all these different plans, and you don't know which one to take. It's a different animal. So if you have taken
Should
care of
that be the first thing that you do before you go to the dentist is go research the insurance policies that might cover it?
I would see what insurance policies my that I would see what insurance my dental what dentists are in what dentists are in connection to my insurance. Right. That's what I would do.
So get the dentist first, and then go look and see whether or not what kind of insurances they accept.
Or you can call your look on the back of your insurance card, and they will have a list of dentists that take your insurance.
Yeah, it does get pretty
Sticky.
expensive. I can vouch for that. I've never found a policy that worked for me, so I keep dishing out money. I have great um, uh, medical coverage for everything else. Everything else, I don't pay anything except when I go to the dentist. So I haven't straightened that part out myself. Um, what are the consequences if you don't take care of your teeth as you age?
And that's what I see daily. I work with people that's in the fourth quarter of their lives and they're in long-term care facilities. And I'm gonna some of the consequences are horrible. So say for instance, someone loses all their teeth due to gum disease or rampant decay, and they get dentures. And then the dentures, because you're chewing, you're beating your mouth, you're chewing with your dentures in, that bottom bone resorbs, and then people can't wear the bottom denture. So right then the quality of life changes because the way you eat changes. It changes. So you can't eat certain things because you can't bite. And then the upper denture, you have to put a lot of adhesive in it. And that's horrible because your dentures move around. And if you can't afford implants to hold them in, that's a different level. Other things are when you if you go into the long-term care facility and a tooth breaks off because you have dry mouth because of the medications you're on. A lot of older people have to take a lot of medication that causes dry mouth. You get cavities on the roots of your teeth, right at the gum line, and the teeth break off. That can be very painful. So your tooth break off, you're immobile, you're in a wheelchair, so it's hard to get in the dental office. So someone has to come to you. Because you think in a dental office, their chairs are bolted to the floor. So if you're in a wheelchair and you can't transfer easy, it's
Uh,
hard to get from the wheelchair to the dental chair. A lot of times in the long-term care facilities, they use hoarders to get people out of the bed into their wheelchair. So imagine you go to the dentist, how are you going to get from the wheelchair to the dental chair? And a lot of
I never
times,
thought of that before. I never even thought of uh, that problem. So you have to rely on a mobile dentist when you have the need to be able to be moved from a wheelchair to a dental chair. You have
uh,
to
uh,
rely on a
unless you
mobile
can,
unit to do that.
unless you can find a dentist that'll take you in a stretcher. Sometimes, I've seen people have to go out in a stretcher to the dentist. The state of one of the senators or one of the governors, someone, a councilman, somebody called my company from a small town in Georgia, and it was a man. He was only like 62, but he had Parkinson's disease and he really couldn't move anything. He couldn't walk and everything. And so they said for him to go to the dentist, the ambulance ride alone was $500 each way. So they asked our company, could we come out? So we went out, and he's a great person. We seen him. We did a cleaning, and now we gave X-rays and fixed some fillings. But someone like that, $1,000 dental ride, he was homebound. So a lot of things, if you can prevent them, stop, if you can go to the dentist, do have good oral hygiene, take care of your teeth, get cavities fixed, get your bridges done, get all that done before you get to the place where you can't move around or when you don't have the extra resources to take care of that. Because dental care can be expensive and it costs a lot for a dentist to leave his office and come to see you in a home or
How does mobile dentistry work? Under what circumstances will you need mobile dentist? Are there other circumstances besides being in a wheelchair that you might need a mobile dentist?
Well, I'm going to clear things up. Because when you say mobile dentistry, people think of a big van, and that is true for some. Some people think of a van that has a dental setup in it, and that is true for a lot of places. But what we do, and a lot of people do, is portable dentistry. Everything that you see in a dental office, we have portable. The suction, the drill, the air and water, we have portable. And oftentimes we go to the long-term care facilities and we set up in a room that they'll give us. We set up our little everything that we have, we set up. And oftentimes we'll have them put the people in a chair that can recline. And we have our light on our head, and that's how we work. So we're what you call portable dentistry. We take the
Portable, not mobile. Portable is different than mobile.
Absolutely. Now, some people do mobile dentistry. They have a wheelchair lift in the back. They can roll the people right on there and they go in there. I don't, we do have a van, but we don't use it for the long-term care facilities. We use that for Head Start because we do the little kiddos too. But for for the seniors, we take dentistry to them because a lot of times they don't even like leaving. And then sometimes you have inclement weather. So it's just better to take the equipment into them.
Now, would this be, what was I going to say? If you're living at home still, can you get that kind of service, or do you have to be in an assisted living or long-term care facility to take advantage of portable or mobile dentistry?
It depends on if it's someone in your area. We do a lot of it in our community and all in my both of the states that we're in. We have a 1 or 2 days a month where we just do homebound, and we
You do
stay
homebound situations.
homebound situation, group homes where there may be people with special needs, and we'll do the group homes. Boy, we do group homes where men live in that have special needs and sensory needs that need to be taken care of. We'll do them in their home.
And does that have a cost? It costs less than an ambulance, but more than a regular visit, or is it covered by insurance? How do you pay for it?
It depends. If they
And
have
how,
insurance, some we take a wide range. If they have insurance, we do it. If not, we people pay us and different things like that. But we try to build insurance. But like I said, the thing is, and this is what makes it so challenging for dentists. When people retire and they have the Medicaid, that doesn't pay a lot. And if you pick one of those supplement plans because you have Medicare is medical. You have to pick a supplement plan for dental. You have to pay extra for that. And even they don't like to pay a lot. So, you have a dental team that weighing whether I'm going to do more, make more in my office or go into the community. So I encourage people. I go out and speak to seniors when they're living in assisted living facilities, when they're living in community homes. I talk to them about the importance of using fluoride toothpaste. If you don't use fluoride toothpaste, use something that could really coat your teeth, and use electric brushes. As we age, our dexterity changes, and you think you're doing a good job, but you're not. Use an electric brush. Get a floss, a water flosser. Take care of your teeth. When you feel your mouth dry, drink water. Use xylitol gum. Those things help us keep our teeth longer, because if you don't have good teeth, and even when you wear dentures, the quality of the food tastes different. If you have a denture where it covers up the top of your mouth, when we eat our food, it's a part of filling the food in your mouth that makes it taste a certain way. You can't feel it if your top of your mouth is covered up with a denture. You can't properly chew your food sometimes with dentures, or if you have a broken tooth or missing teeth. You don't chew food good. You swallow whole balls of food, then that messes up your digestive system. So it's one thing that leads to another. If your mouth
the
isn't
knee is
healthy,
connected to the joint, is connected to the, it's all connected.
right. And if you're not brushing your teeth,
What kind of medications can precipitate problems with your teeth?
anything that causes dry mouth, asthma, some diabetic medicine, high blood pressure medicine, antidepressants, all of those have side effects. Some of those medicines have side effects. Any sort of cancer treatment, any of that. A lot of those medications have side effects to dry mouth. And if your mouth is dry, saliva, we need that to help us digest our food, but it also rinses the plaque off our teeth. And if the plaque stays on our teeth at that gum line,
How do you know when you have dry mouth?
it feels it. You can feel your mouth dry. If your lips stick together when you talk, if
Uh,
you can feel dry mouth. Trust me, I'm in the middle of menopause. I'm all dried out. You can hit me and I don't even cry. I don't even have any tears right now. So you could tell when you have dry mouth.
Okay, I guess I haven't had that. But you know what I did have, and I don't know whether or not this is a dental problem and if there's a difference between dental problems and orthopedic problems. But I think I woke up one day and all of a sudden my jaw was not biting correctly. And is
Mm.
that considered dental or orthopedic or orthodontic?
Okay, orthodontist is braces, but but I would definitely, if you said you woke up, that was one key for me. You might have been grinding or clenching in your sleep, which means this TMJ, the temporal mandibular joint, might have been doing something in your sleep. I would definitely see a dentist about that. They may need to get you a night guard or bite guard or something like that, because that could
I did
really.
I did go immediately. I said, "I don't know whether or not I'm imagining things, but I really think all of a sudden my jaw was not connecting correctly." And I said, "I don't know whether or not I'm retreating to the time that I was in 5th grade and I had to get my bite corrected by an orthodontist." But I went to an orthodontist and I am going to start wearing something called Invisalign.
Invisalign is
Um,
perfect.
it is okay, good. Let me ask you another question. What about the foods you eat? Are there foods that you can eat that can help strengthen your teeth, or are there foods you should not be eating in order to have better health with your teeth?
I just feel that, we can eat anything in moderation as long as you have good oral hygiene. Of course, we would always tell people to stay away from sticky foods that stick to your teeth, and too much sugar, too many sugary foods, and carbohydrates are horrible. Soda, those power drinks, those Red Bulls and all those strong power drinks, all of
Not
those.
having all those foods will help your waistline too.
Right, right. But a lot of those, but if you have good oral hygiene and you do stuff in moderation, most of the times you're okay. If you're brushing your teeth twice or at least a minimum of twice a day, it's so important to brush when you first wake up, because no one wants to smell your breath. But the best thing is to brush before you go to bed at night, because everything you've
Okay, so what
eaten.
is the routine for brushing when brushing? What routine should you have?
I would tell, first of all, brush your floss the teeth you want to keep. Okay, that's the first thing I tell. Floss the teeth you want
That
to
would be
keep.
all of them, right?
Right. So because brushing your teeth alone is just like going to the bathroom and just wiping your cheeks off. If you do number two, you need to get in the middle. And that's how floss is. You need to get in the middle, because the bacteria lay in the middle of your teeth. So I tell people I tell anybody over 40 or 40, 45 should use an electric brush. Brush your teeth and floss your teeth. Or use a floss pick with the water. That's good, and do that every morning. Maybe rinse out with some mouthwash. If you can brush after you eat at lunch, that'll be good. But always brush your tongue with a tongue cleaner, because your tongue is like a sponge and it holds a lot of bacteria. A lot of odor stay on your tongue. Your tongue has a lot of stuff on it. You can take a spoon and scrape your tongue, and you'll be surprised you see what comes off of it. So I tell people to get a tongue cleaner. But a really important time to brush
Did
it.
you get that just at your regular pharmacy, or you have to go to your? No, I don't use one of those, so I'm gonna have to start using. I didn't know about the tongue brush,
You need to brush
so
your tongue.
that's different than a flossing,
Right.
right?
And I don't tell people to use their toothbrush on their tongue, because if you brush the plaque off your teeth and then you brush it in on your tongue, it's like a big soup full of nastiness right there. So sometimes the back of the brush have a little scraper on it. You can scrape your tongue there, or you could buy a tongue cleaner. But to me, the magic
And you
happens.
just get that at your regular pharmacy.
Yeah, you can get it
It's
at
called the.
any pharmacy.
And is that something that you throw away every night, or that's a
Oh no, you can
tool
rinse
that
it
you?
off. You can rinse it off. You can rinse it off.
Okay.
You can keep it. Now, to me, the magic happens at night, because everything you've eaten, drinking, smoke, whatever you've done, is on your teeth. Think about this. If you eat, drink everything all day and you hop into bed, bacteria grow in warm, moist, dark environments. Say, for instance, you had chicken for lunch. You got a little bit of chicken left in your mouth. You close your mouth for, say, 6 hours to go to sleep. You got rotten flesh in your mouth. This is why people wake up with this dragon breath. You know what I'm saying? So I encourage people to brush
Yes.
their teeth, floss at night, clean your tongue, do a good rinse, and then you'll have a better oral health.
How often should you get your teeth cleaned by the dental office?
Well,
And
and
how is that different from doing it yourself?
when you can brush your teeth yourself, but when you go to the dental office, they recommend every 6 months. And
Uh-huh.
let me plug in about this toothbrush. Some people don't change their toothbrush until they go to the dentist. I think people should change their toothbrush at least every 2 to 3 months. I change my
Okay.
toothbrush way more often than that, but that's not good. And another key I want to drop, these are tooth fairy tips. Cover your toothbrush up. Cover it up. Think about it like this. All the stuff floating around in the bathroom. When you flush your toilet, I don't know how close your toilet is to your sink, but that was aerosol sprue when you flush your toilet, let you put the lid down. Imagine that getting on your brush and you putting that in your mouth. So cover your brush up with the little cap with the little
That's a
holes
good
in.
tip. So you should keep your toothbrush. Well, if you're using a regular toothbrush, you should keep it like in one of those plastic containers, or what do you cover it up with?
Well, they have toothbrush cover, and they have little holes in it so bacteria won't grow. So a little bit of air can get in there because you put it in there wet. But always cover up your brush, even if it's an electric brush, cover it up. And one more tip I'm giving you, and this is something that I discovered. No one said this. If you get sick, if you get a cold, throw your brush away because that
Huh.
bacteria is on your brush. When I get sick, we go to the dollar store and we get little cheapy brushes. And every day we brush our teeth and then throw the brush away because it makes it when that bad C word was out, COVID, we kept getting reinfected. And one time my husband said, baby, let's just start using new brushes. And it cleared up because I got it a couple of times and it cleared up every time.
Wow.
So yeah, these are just little tips that we don't know. Keep your brush covered. Brush a minimum of 2 times a day. And floss. Flossing is just as important as brushing. And try if some people are dead against fluoride, I don't push it. But if you're against fluoride, make sure you're rinsing your mouth good after every meal and that when you're brushing too.
Well, these are great things. I thought I was taking great care of myself, but I can do better. So wherever it is that you're at, you can take it a step further. Is that it?
Yes, ma'am.
How did you ever get into this?
Well, my grandmother was in a nursing home and she had dentures and they weren't taking care of her mouth. They wasn't cleaning her dentures. And I would go visit her and see her and I noticed that they weren't taking care of her dentures. So one day I started doing her dentures. I started cleaning her dentures and every day I would clean her dentures. And one day she was in a room with a lady and her roommate said, can you clean my teeth? They don't come out like your grandmother. So I said, okay. So I went on her side of the room after I finished with my grandmother and I started looking for her brush and she didn't have one. So I went to the store and brought her one. And when I brushed her teeth and flossed them, she smiled and it felt good to capture that smile. Well, my grandmother, she liked to smoke cigarettes and she would always tell me to bring her cigarettes. And I was like, grandmother, you're diabetic with congestive heart failure. You got oxygen. I'm not bringing you no cigarettes up here. So what she was doing, she was telling people that my granddaughter's a dental hygienist. If you give me 2 cigarettes, she'll clean your teeth. So every time I went, there was a lot of people coming to her room. One day I went in there and there was a line of people outside the door. I went to look for my grandmother. She was outside smoking cigarettes and we called her Mother Dear for Medea. I said, Mother Dear, what is this? She said, I was telling people if they give me 2 cigarettes, you will brush their teeth. So she was bartering me out. But my grandmother ended up transitioning, but I knew then that there was a need. In honor of her, I started
Had
doing.
you already been in another career and then you switched when you saw the need you were fulfilling with your grandmother? Or
No, I was
um,
already a dental hygienist, but I was working in private practice. But when I seen the need with my grandmother, that made me switch to long term care. I started doing it for free, and I believe that your gift would make room for you. And once I started doing it for free, I end up after 5 or 6 years, we end up getting paid to do it, and it's been that way ever since.
well, we are glad you made that change and that you can give us all of this. I've learned a lot on this conversation. I appreciate it. One last question, and then I've got to hop. What I don't use mouthwash. Should I?
I recommend mouthwash. I really do, especially in between meals and especially after you brush, just to get a good fresh rinse out. That's just a personal opinion of mine. I am a mouthwash user.
So you have some in your purse and you go out for lunch. You
I brush after lunch. I brush after every
good.
meal. I brush up because I want to see. I have nice teeth and I want to keep them. I see what happened. And who wants to go to
Yeah.
a dental person with bad teeth? That's like going to a hairdresser with no hair. So you want to make it make sense, right?
What do they know if they have no hair or no
There
teeth?
you go.
Well, that helps us to that helps us to get on track. If you haven't taken good care of your teeth until now, get started. Get a dentist, get regular cleanings, get all the right equipment, do it regularly, and if you need some help, get it, because it's going to make a big difference in your overall health and well-being. So I want to thank you for illuminating all of that with us today, Dr. Dunbar, and I keep doing what you're doing. Is there anywhere people should get in touch with you?
SonyaDunbar.com. SONYADUNBAR.com.
Okay, and are there other, like, how many states does your mobile and portable dentistry travel to?
We're in 2 now, branching out to 2 more.
And if are there other people like you in other
A
states
whole
that
bunch
people
of
can?
us out here. A whole bunch of mobile. Just
Is there
Google
an association of a particular association people can call to get a local contact?
Yes, the National Mobile Intellidentistry Conference and the American Mobile Intellidentistry Alliance, the National Mobile Intellidentistry Conference, and American Mobile Intellidentistry Alliance.
Okay, so if you didn't get all of that and you need to ask Dr. Dunbar, you now know where to reach her. So, again, I want to thank you for taking the time to be here today, and to the audience for listening to how dental care can improve your well being now and in the future. So, uh, if you haven't visited my website lately, please go ahead to www.decluttering55plus.com and sign up on the Let's Connect button so we can alert you to other new and interesting podcasts coming down the pike. Please send us a note and tell us how you're doing with your dental care. What challenges do you have? How do you overcome them? What practices are you going to put in place so that your teeth are as strong as you are as the years go by? If you have not gotten a copy of my book, Decluttering 55 Plus, Wisdoms to Create a Legacy, Not a Mess, please go ahead to Amazon.com or layitflat.com and pick up a copy for yourself, your friends, your family, so that you too can enjoy the 29 illustrated prompts that the book will inspire for you to get things done. And you know, when it comes to getting clutter free, action is the only thing that makes a difference. Be sure to like, subscribe, and follow Decluttering 55 Plus on Facebook, Instagram, LinkedIn, and TikTok so we can grow this community. That's all we're going to have time for today. So, again, thank you, Dr. Dunbar, and thank you to all you folks out there. We'll see you next week. So, between now and then, be sure to have a clutter free day. Thank you.